Clywyd. I've heard a lot about absence of evidence. It's not evidence in itself, but where there is evidence of absence, that is evidence in itself. So if you have a lateral flow test, it is proof of absence of COVID. So I just want to turn that on its head and maybe allow some on the benches that side to reflect on it. It is a fact, and it is evidenced, that those who are vaccinated are less likely to spread COVID around them. So while the data on COVID passes and the latest restrictions are collected, logic and common sense does support this action. In a minute, because I heard quite a lot of you early on, and they are popular. These COVID passes are popular. I don't know who you're speaking to, but the vast majority of my constituents get it. They understand it. If everyone at a venue is either vaccinated or COVID negative, then it has to be safer for all of us to go there. That's what people are telling me. People that won't normally go out are saying to me, actually, we will feel safer now. They're good for businesses as well, not something I've actually heard you say, because the disease destroys economic confidence. That is not a cure. The vaccine passport does actually mean that it will be a cure for businesses, because people will have confidence in those businesses to go to those businesses. So without these measures, fewer people will attend those venues. Fewer people will attend those events, certainly the people that speak to me. And
Joyce Watson, there's an intervention on Zoom if you would want to take it. It's from James Evans. It's your decision.
No, I'll take this one over here.
Darren Miller, are you still wanting to intervene?
Yes, I am. You were talking about facts earlier on. The facts are this. You can have both COVID jabs and still catch and spread COVID. You can enter into the COVID pass system a negative result even if you've had a positive one. That does not protect people. That undermines confidence in the system, and that's why this is the wrong way to go about trying to shore up confidence. If it was so popular with businesses, why are they all objecting to it? Why are businesses not? Why are businesses?
This is too long an intervention now.
Why are the trade association bodies objecting to it?
That wasn't an intervention. That was an attempt to take over my time.
He didn't succeed. Carry on, Joyce
But
Watson.
the point is this, okay? It seems to me that you have a problem, that you don't trust people to take a lateral flow test and give their own result. It seems to me that you can't trust people. Well, we are prepared to trust people here to do the right thing. But let's go back to where we are. In terms of fairness, they are fair because they give people more confidence to enjoy more freedoms. You talk about freedoms, I've heard that word here. They actually extend civil liberties, not restrict them, because they allow people to feel safe, they allow people to be freer. Therefore, those people's civil liberties are being extended. So I absolutely support your decision, Minister, to extend the measures to cinemas, concert halls and theatres. It is, after all, and it's been said many times, one more way to keep Wales safe at alert level 0, because the alternative will be, if we carry on, having to look at other measures that might be more restrictive. But I am somehow at odds to understand how the Tories here can, on the one hand, be in government in Westminster, requiring, mandating NHS workers to have vaccines before they can work, and yet you won't support what is a very, very simple process of COVID passes in Wales. So I'm just a little bit staggered. I just think somehow what you're doing here in your objection today is voting against just for the sake of doing it, not for the sake of looking at the safety and the freedom of people to carry on doing what they want to do in places where they want to go, knowing that they have an element of safety and security that we are hoping here today to deliver for them, giving them their freedom, giving businesses their freedom to operate. Thank you.
The Health Minister to reply.
Well, diolch yn fawr. Thank you very much for this debate, and it's been a very interesting one, as we expected. I think, first of all, I think it's probably worth pointing out that we know that this virus spreads in confined spaces when people spend a lot of time there. And that's exactly what we're trying to do. So there's plenty of evidence to support that. And that is what we're suggesting and why we're keeping this restricted to those areas. And I make no apologies for proposing this restriction when rates are so high and we are just entering our winter period. And we don't make these decisions lightly. We know that we're in a situation where our NHS is really struggling at the moment, and we have over 800 people in hospital with COVID. And anything we can do to try and alleviate the situation and the pressure on the NHS at this point is something that we need to consider very seriously. And you'll be here next week complaining about how we can't get people into hospitals. Well, this is a measure to enable us to get fewer people in hospitals. Now, experts tell us that we should go early, and they tell us that every little contribution adds to our ability to contain what is a deadly virus. And it's no surprise that the evidence is still building. This is a new virus, and it's constantly changing. The Delta variant spreads 1,000 times faster than the Alpha variant, and now we've got a subgroup of the Delta variant, the A14.2. And we don't know much about that. So, of course, the evidence is always going to be building. Let's not be surprised by that. And certainly, this negativity is not the response that we're seeing from the general public, as so many of my colleagues has emphasised. And our first duty as a government is to keep the population of Wales safe. And you tell us to focus on the vaccination programme. Well, I can tell you, we are going flat out, and we're going a damn sight faster than the government in the United Kingdom, although we know that's not a race. But certainly, when we talk about self-certification, it is important that it is about trust, and individuals are required to honestly reflect their vaccine status or the result of a test. It's the same system as the UK government is asking people to use when they return from travel abroad. And it's an offence to falsify information to gain entry into a venue. Thank
you very much, Rhyn, for highlighting the article in The Lancet, put forward by Imperial College, and I'm pleased that that information helped Plaid Cymru to come to their conclusions on the regulations today. It's true that the passes won't work in isolation, and every small step does add to our efforts to limit the spread of this virus.
Two of the Plaid Cymru speakers asked about the situation in relation to those people who find it difficult to have vaccinations or to take tests. And we have been looking into this and taking it very seriously, and thank you for persevering with that questioning. Now, the Welsh Government did approach Public Health Wales for advice on suitable alternatives to swabbing back in June. And Public Health Wales' advice was that buccal swabbing, which is a swabbing inside the cheek, could be a viable alternative for some people. So Public Health Wales have conducted work on creating a protocol, and they've been evaluating a comparison of throat swabs in a paediatric department, and they've been really encouraging results. So Public Health Wales will now move forward with a real-world comparison of buccal swabs versus the traditional swab with 2 special schools in Wales who've agreed to take part. So all of this work is advancing. I'm hoping that this, if that all works out, that we'll be able to roll it out as an option early in 2022. So there are advances there. Can I just finish by saying that this pandemic is absolutely not over. The NHS is struggling and winter hasn't started properly yet. Our rates are the highest in the United Kingdom, and we would all like a more normal Christmas this year. Well, that is unlikely to happen unless we all take these measures seriously. And our experts are telling us that those marginal interventions help, but they help if we go early. And we know that the vast majority of the Welsh public are with us on this. They're comforted knowing that people around them are also conforming with our rules. And the one thing we've learnt over the past 18 months is that we don't exist, as John Donne said, that no man is an island, but we stand and we fall together. And the people of Wales are happy to demonstrate their solidarity with one another and will, on the whole, welcome this new intervention. These minor restrictions, so that we can have the best chance of keeping these venues open during these difficult winter months ahead. I think the people of Wales will come with us on this, and I do hope that the Senedd will vote for these regulations today. Diolch.
A question.
The proposal is to agree the motion. Does any member object? There is an objection. Therefore, we will defer voting until voting time. Item 6, the Representation of the People Amendment Wales Coronavirus number 2 Regulations 2021, and I call on the Minister for Finance and Local Government to move the motion. Rebecca Evans.
Diolch, Llywydd.